Every week, thousands of people ask us the most important question in the world. What can I do? So every week I turn around and ask someone who knows what the hell they're talking about the very same question. Someone who already answered it for themselves, someone working on the front lines of the future in global health, in public health, in climate change, AI, any of the tangled crises we face. We find out why they're doing the work they're doing and what we, you and I, can do to support it. Join their work, to fund it, to fight for it, to find our own way to the front lines of the future. I'm your host, Quinn Emmett, and my guest today is Edna Bonhomme, a historian, author, and public health expert who looks at disease and captivity through her own personal story of near-death illness, Haitian migration, and a lifetime of asking, why does our world blame instead of heal? Edna is the author of the new book out now, A History of the World in 6 Plagues, How Contagion, Class, and Captivity shaped us from cholera to COVID-19. If you've ever wondered how pandemics warp our social fabric and what it would take to heal old wounds and stop repeating the same mistakes, stick around. For questions or feedback, you can email us at questions@importantnotimportant.com. Let's get into it. Edna, welcome to the show. Thank you so much for joining us today.
Thank you for having me.
Absolutely. Just showed you, got the book. I've got the digital version, all of the above. 6 plagues, not 7. Not yet. We're working on it, though. We'll get there. Hopefully not. Thank you so much for joining us. Where are you today? You said New York?
So today I am based in New York City. However, normally I live in Berlin, Germany, where I've been based since 2017.
That's awesome. It's a great city. It's a great city. That's super fun. What brings you to New York? Is it all of this?
So yeah, you're correct to say that part of the reason that I'm in New York City as well as the United States for this month is to promote my book, A History of the World in 6 Plagues. So I started off the book launch in Miami, where I was born, and I arrived to New York, where I also lived for a long time. And it's been a homecoming to see friends, family, and intellectual kin and exchange ideas about not just this book, but the many projects that I and my other people that I know are working on.
That's awesome. It's always fun to share in friends' work. It's always easier to talk about other people's work than our own, but that's awesome. So we usually ask this sort of 2-part question to kind of get this thing going. It's funny, sometimes I say, oh, these conversations aren't necessarily about your life history. It's really like, why do you do this work and how can people support your work or find their way into it? What can they learn from it? What can they do this and this? But this book has a lot of you in it on purpose. It starts with you. And so if you've read the book, folks, you might already have the answers to this yourselves. But Edna, I wonder if you can talk us through it. So the 2-part question is, why do you have to do this job? So basically, of everyone in the world, why you to do this intimate scholarship? And why do you have to do this work? And again, that's in there, but why do you feel the need to uncover these histories and speak so openly about your own traumas and your family's story and what that means to these 6 plagues and how we go forward?
So one of the things I would say is that I am in conversation with literary greats, even if they're alive or dead, insofar that one person who has had a major influence on me ever since I was quite young is Toni Morrison. And she once said that I wrote the first book because I wanted to read it. I thought that the kind of book with that subject, the most vulnerable, most undescribed, not taken seriously, had never existed seriously in literature, but also through thinking about the archive literature and so forth. As someone who had a circuitous path in terms of being trained in biology for undergrad, have a master's in public health, as well as a PhD in history of science, not only do I have the framework for thinking about knowledge and our relationship to science from the perspective of a microorganism and the innovations that we've had, but I also think about how we as human beings interact with each other, how we feel ill, the ways in which public health decisions are made, and how that has been done throughout time. And so when COVID-19 lockdowns emerged about 5 years ago, I was really curious to get a sense of how individuals in the 18th, 19th, and 20th century really work through various forms of quarantine, confinement,
Mm.
captivity, and specifically the anxiety and fear that I saw arising in various society, various social media platforms or amongst friends. I wanted to get a sense of how people could work through that in a
Mhm.
collective sense. And so there are bits of myself in the book primarily because some of the authors that I admired the most, whether it's like Joan Didion, who is an essayist and brilliant writer, to even someone like Gia Tolentino, that there is a bit of their lives integrated into this narrative so that people can understand why an issue might be important. Everyone has been sick at some point in their
Mhm.
lives, and in many cases, we recover from those illnesses. And I think the goal of the book is to work through how we manage illness, mostly physical, but also from a psychological perspective as well.
And I appreciate that. This whole thing started with a newsletter, and a few years ago, we gave it this subtitle, Science for People Who Give a Shit. And you either see that on the homepage and go, oh, that's for me, or you're like, what is this nonsense? But because of COVID and the myriad side effects of climate and so much else, poverty, I mean, you name it, food and water, I mean, climate touches everything. But there's fortunately and unfortunately many more people who give a shit than ever before. And like you said, so many famous writers, famous artists, people who went on to do things in public health or medicine or even policy have a leg to stand on in a sense that they didn't just study it in so many different ways like you did, but because they have been a part of that in some way. And sometimes they come to approach that work directly or indirectly or in a more generalist perspective. For folks who haven't read your, again, very intimate book, and not just about yourself, but again, like what you see in every, Virginia Woolf, is throughout it, and that's wonderful. Paint the scene for us a little bit about your time being hospitalized for typhoid, your parents' fears, the language barrier you dealt with that was both, exclusive and inclusive in some ways, and how that has really, again, planted the seeds for you to do this scholarship, to do this work, to help us find a better way forward.
Yeah, so one of the things that I do in the text is to really lay out how epidemics emerge in different historical contexts, from cholera to HIV/AIDS to Ebola and so forth. And one particular disease that I focused on and the way that I integrate myself is thinking about a disease that had not been an epidemic at the time that I got it. That is to say, typhoid fever in the United States in the late 80s, but to think about how even though this illness was not an epidemic in the 1980s, it had been, and that the fact that it can be quite debilitating and confusing to a young person is part and parcel of what I was trying to lay out for the reader of the book. Given that, one of the things that the ways in which I, as a young person who was hospitalized, was trying to make sense of typhoid fever. I
Mm-hmm.
did not fully understand the disease. Being hospitalized for a specific amount of time also played a role in terms of my fear and anxiety and confusion. And as you alluded, my parents being migrants also did not fully at times understand the medical system. So the confusion on many levels by virtue of being a younger person, by virtue of this disease being quite debilitating,
Mm.
hospitalization, and linguistic barriers all played a role in the fear and anxiety that emerged at the time. Nevertheless, one thing that I would say that I tried to lay out in the book is that my confinement in a hospital setting under duress, the sick bed, can itself be a privilege by virtue of one being able to get the care and attention that one needs. Part of the reason that I and many other people who have been treated for typhoid fever in the global north survive is because of medical innovation.
Mm-hmm.
It's also because of the facilities that are provided. And one of the things that I ultimately say, not just in this book, but in other writings that I've had, is that I hope that as a society and that globally, we can be able to provide everyone with the same type of top quality care
Mhm.
vis-a-vis universal health care, Medicare for all, whatever people want to call it,
Mhm.
so that people are able to survive diseases that had at one point caused massive death.
Sure. No, absolutely. Who was it? Was it the Secretary General of the UN or the head of the World Health Organization? 2022-ish, something like that. Simple tweet. I'll find it. Basically talking about how the West thought they were more prepared than they were for something like this because they were so
Mm.
focused on high-end medicine instead of public health, which we'd kind of really let our foot off the gas on. But that's all still relative. Like you said, there's still beds to be had in so many places. Even in the UK, which has pillaged its public health system in the past 15 years, like it's still leaps and bounds more than other places that were colonized and then left on their own. Tell me a little bit, because again, it really does matter. So many of these conversations, I try to ground, again, not just in like your life story, but to try to help listeners who give a shit for whatever reason find their way into this or public health or climate investing, like whatever the thing is. I want them to hear something that makes them go, oh shit, maybe that is the thing I didn't think about is my trigger, is my way into whatever this thing is, by hearing such a diversity of stories. So I do want to ground it a little more in your upbringing, if you can. Can you tell me what the 4-H club was?
So during the 1980s, there was an HIV/AIDS crisis, which most people are aware of. And part of what was specifically traumatizing for that period, as well as difficult, is that there was a lot of confusion as to who was most susceptible
Mhm.
to getting HIV/AIDS. And in many cases, the government, that is to say, the United States, and denying or not actually having the bandwidth to really acknowledge that many people needed the assistance that they needed, or even to say that there are certain vulnerable groups who have the disease. Nevertheless, when it came to thinking about who was most susceptible to getting HIV/AIDS, whether or not that was true or not,
Mhm.
there was this perception that there are four different types of people who were most likely to get or have HIV/AIDS. One of those groups being heroin users, the other homosexuals, the third being hemophiliacs, and the fourth was Haitian. Within that context, the fourth group was the only group that was based off of an ethnicity, and that had a lot to do with scapegoating more
Mhm.
than any biological or physiological difference between Haitians and the rest of the world. And part of the reason for that scapegoating and that stigmatization had more to do with how the US perceived Haitians as a vector of disease, as being people who were licentious or other characteristics that had very little to do with the multiplicity of lives and habits that Haitians had. So I talk a little bit about that in the book, but I also, in one of the chapters, rather than focusing on that 4-H club, I actually turn towards thinking about how people in prison, and more specifically in a women's prison, dealt with the HIV/AIDS crisis through peer counseling,
Mhm.
mutual aid, so forth at Bedford Hills in upstate New York. And part of the reason I wanted to do that is to show that the epidemic had took on a different life depending on where people were,
Mhm.
and that it wasn't always a story of trauma, even
Sure.
if it was quite harmful, but that people use their activism and they use mutual care in order to provide some type of dignity to the most vulnerable. And in a sense, that chapter can hopefully serve as a blueprint for how we as a society can be more caring to each other and provide the structural foundation for a evidence-based public health approach that also is distributing resources and compassion to everyone.
It seems obvious. It is not. You Thank you for mentioning the chapter about the women's prison. You talk even more broadly, and we've talked about it a bit here as well, as the way any sort of, again, coming back to climate or public health, the way prison conditions are a huge just you want to call vector, threat multiplier, whatever you'd like for any of these conditions, whether they don't, in Texas, how there is, no air conditioning of any kind in so many of these places, and the way COVID obviously tore through these places. Huge, complex, monstrous problem. You found a way going from plantation medicine under chattel slavery to these modern forms of confinement and the immigration detention centers, and you use the word captivity instead of quarantine or isolation. Again, coming back to your own version and how that felt, not understanding why you were in this bed and not understanding it and all this history. What does captivity capture, I guess, about the lived reality of so many of these epidemic responses? The enslaved women, Haitian migrants, like your parents, quarantined Ebola villages in Africa in 2014, like that, I guess these more clinical terms miss.
Yeah, so I think one of the first things to acknowledge, especially given my public health background, is that the importance of something such as quarantine, which is a specific term referring to the restriction of movement of people, goods, and materials, mostly with respect to thinking about preventing the spread of disease or pest of any sort. And the quarantine as a modern concept is something that was developed, at, as far as we can know, within the Italian context during medieval Europe, when the Black Death or bubonic plague reigned throughout the 1300s. So to an extent, the quarantine had served both in a public health context with restricting the movement of people through trade so that disease wouldn't spread, but it's also entered into people's, imagination as a way to, as a metaphor, as a kind of literary device, and so forth. And so, although quarantine means so much, depending on who's saying it, and it could be misunderstood, I thought that it wasn't a term that was enough to describe the various social processes that have happened in the modern era from the time of the scientific and industrial revolution to the present. So, in a sense, captivity and what that means with respect to confinement or the political dimensions, or even how we see ourselves in relation to choosing our own form of confinement was significant and important for me. And it is because of that that I also wanted to look at various institutions which their original intention isn't necessarily to prevent the spread of disease. Rather, it could be, in the case of chattel slavery and the plantation, that force people into a space and force them to do free labor. In the case of a concentration camp, also that could be for all kinds of reasons, medical experiments and the dehumanization and also forced labor. In the case of any form of imprisonment, to take away people's time, their freedom of movement, their dignity even. And perhaps if, people are trying to be as thoughtful as they can be to think about making amends, which I'm not sure prison is the way or the route towards
Yeah.
making amends. All of this is, I wanted to be expansive about these various forms of confinement, whether it's by choice or through force, and how disease really moves through those spaces. Or in some cases, especially if one is thinking about having and finding refuge in one's bed because one is sick, perhaps that is the place in which that confinement can give people the ability to fully rest. And it's in the flu chapter that I really think about the bed and Virginia Woolf's theorization about the bed, both in her essay writing and as well as in her literature, and how we can understand ourselves and how the bed could be also a site of inspiration.
It is. It's complicated, right? I mean, we've all been, I certainly didn't have typhoid as a child, but, we've all had that feeling of influenza. And if you've had it, which was one of the frustrating things at the beginning of COVID, when people are like, it's just the flu. If you've ever had the real flu, it's not great. It does numbers every year, even with the vaccines. And the bed can feel like a refuge and a place where you need to go through what you need to go through and turn into feeling like captivity. But at the same time, like you said, it's so complex, but it also seems to be so simple because it keeps happening throughout these 6 plagues, that even how infectious disease works and public health works and any viral benefits to isolation and quarantine, it does seem to always end up in a version of captivity for some
Mhm.
folks. And it seems to be the same folks, whether because of, your early childhood in Miami and being basically born into the misinformation about Haitian people and how they're a vector for these things, to where we are today. It so easily seems to find its way there. I'm not sure if you're familiar with the woman who worked on the mRNA vaccines for so long, won the Nobel Prize last year. And her book's great about her childhood. And
Mm.
she said one of her earliest realizations when she finally started to learn about viruses, sort of very quickly understood that the viruses are not as much the problem as the people.
Well, one thing I would also add to is one particular institution has had an influence in ensuring that certain people are confined, and not just confined with respect to freedom of movement, but also in their ability to be free and develop and so forth, is colonization, which I talk about in the book on my chapter on sickness and the legacy of Robert Koch. And it really reminds me of colonization and racism as a whole, as a form, as a disease,
Mm-hmm.
ultimately.
Mm.
And that is also something I'm trying to like work through in the book, how the political institutions that confine people, that make people sick, in themselves have a moral complexity and are also morally diseased in how they perpetuate violence and so forth. I'm not the first, or nor will I be the last to make these comparisons, but it's important to know that these institutions should be questioned,
Mm-hmm.
especially if they have a new form, whether it is highly dependent soft power or foreign aid that isn't effective at building sovereignty,
Mm-hmm.
or in some cases, ways in which some nations have had to pay for their freedom or were not compensated when enslaved people were taken elsewhere. And so part of what I'm also working through is that I hope that people can be more curious about how long-standing political structures of conservation, free labor, settler colonialism, and so forth, or imprisonment, create a situation that make people not just physically ill, but also psychologically distressed.
But that's it. It's choices over time. These are all man-made systems that, like you said, make people sick in a number of different ways. And we're very aware that we don't have to continue with the same versions of these systems, whether, like you said, it's concentration camps and Robert Koch, or whether it's plantation medicine to do just enough that the slaves could continue working, or it's redlining, right? Or whatever it might be. These are all man-made. They're choices we continue to make at local, state, federal, international levels, from colonization to current countries and communities in the way we treat these folks. And it's one thing to say that everyone should have healthcare and have healthcare insurance. And then it's another to say, why do we keep making all of ours sick in so many ways, but especially specific groups that are very much trapped within these systems? And it has been that way. And the debt there is obviously myriad and manifold and continues to come back to itself. So, on that note, when we think about moving forward, when you think about the HIV/AIDS activism you talked a lot about, and ACT UP, and the local Ebola responses, all these grassroots places and people and ways that communities have really, truly against all odds, reclaimed their wellness and their health, which again is like wholesale health on their own terms. What are some of those that you feel like might be examples we can actually learn from as we go forward? Because you had this great quote, and I wrote it down this morning. You said, Mrs. Dalloway explores what it means to be retriggered by influenza's prospect. And then a little later, how a post-pandemic life never allows certain people to feel reprieve. And, obviously it's just over 5 years since everyone got locked up for COVID. Bird flu. Bird flu feels like it's right around the corner. We need these lessons. We need these examples, right? We don't want the glossy version, and obviously you don't do that, but we do need them now more than ever because we're just as unprepared. As Ed Yong said, COVID exposed the cracks in the sidewalk, and we haven't fixed any of them. So, what have you learned through your experience through working on this book and all of your other work that we might be able to build on before we turn the corner here?
Yes, one of the first things I would like to say is that Ed Young, who is a science journalist, has done such excellent reporting, or not just around COVID, but science as a whole.
Mm-hmm.
And I think that his work, as well as the work of many other science writers, has hopefully allowed and encouraged people to be more curious about the natural sciences and the natural world, whether it is a, sentient fly or a black hole and the origins of the universe.
Whatever it is that gets you in there,
it is,
I don't care.
I hope that people can continue to read about science. Nevertheless, I think that one of the things that I hope this book can also offer people the opportunities to think, on the one hand, about the challenges about global health, that so long as we live in a world where people are moving, and they will be, and they will continue to do so, mostly because we are interconnected, that we have to also bear responsibility to the outbreaks that happen to individuals, whether they're in Cambodia, Botswana, or Argentina. And so part of the thing that in writing this book, that I was also playing with, is the fact that most of the diseases that people die from are actually non-communicable diseases. So long-term chronic diseases, cancer, heart disease, so forth, do play more of a role in the amount of death that is caused. And epidemics, to an extent, represent states of exception because of the acuteness at which they target people.
Sure.
Nevertheless, non-communicable diseases, the climate crisis, health inequities, economic instability, all impact, shape how long people live and whether or not they survive a specific ailment. And so looking at this information, I would say that one of the things that has helped people live longer lives and even just more fulfilling lives is when they have access to primary and preventative health care, where their chronic health is addressed. And also the society is designed so that those who have physical disabilities or other disabilities are able to accommodate and move and function. Unfortunately, there's a heaps of inequalities and unevenness as to who has access to some of this material. And in a sense, my book, by virtue of it being separated on the first half by pre-1945, in an era where most people didn't quite understand what a bacteria or virus was, when antibiotics were not readily available, and we see how that played out with cholera in the first chapter, sleeping sickness in the second chapter, and flu in the third chapter. I also wanted to see how the man-made crises in the second half of the book, by looking at HIV, Ebola, cholera, and then also COVID, I wanted to show how it's not a lack of information or a lack of resources or even medication to address these outbreaks. It's often and has been a lack of will in the contemporary context. And so the thing that I saw in my research over and over again is that when there is investment and when there is a will, we are able to overcome a health challenge. And one of the main examples or success stories of that is the eradication of smallpox, when the world actually prioritized that disease and said, we're going to have global vaccination campaigns and ensure that people are able to have the care that they need. It was done. If we could do that with smallpox, I would argue we can do that with some other communicable diseases. So the most interesting part of the work that I've done is that I do have hope in our ability to initiate change, but I think that it isn't just going to happen by wishing it into existence, but rather through collective action.
I mean, I love that, and thank you. You have such a like a Churchill perspective on it, which is, look, I'm going to tell you how things are, it's not great, but we can't lose hope because look at how far we've come. Look at, like you said, we got rid of smallpox. That's crazy. I mean, look at what happened after Jonas Salk with the polio vaccine, right? We have overcome these tremendous things. I mean, so many children used to die before they were 5. And now in the West and the North, it's much smaller. In sub-Saharan Africa, it's still really not great, but that's a choice we're making, right? And when you look at who was COVID most, who I guess was most likely to die, were the most fatalities from COVID? It was people with, like you said, these non-communicable pre-existing conditions, so many of which are due to socioeconomic choices we just made to marginalize people through heat and food and breathing dirty air and shutting off their water and lack of housing and things like that. And again, like it's very complicated, but it's also not complicated to start to undo those burdens on the one sense, in the foundational sense, to all the way to, you quoted Mike McGovern talking about the human causes begin with the historic underinvestment in the health sector by the 3 hardest hit countries and their aid donors, right? Lack of support to national health workers, lack of equipment, all these things, messaging, whatever it might be. Again, like we can do a better job with that. And I do really appreciate, again, your focus on we have options, we have hope. And I know that can be hard to wrap folks' head around, but we can do that. So on that note, what do you see as sort of, as we try to point people towards this question of what can I do? What are specific things, especially right now, as at least in the US on the federal level, it's a bit of a shit show, on the state and local level, but also in Europe? Like, where are you seeing really tangible, measurable things people can do with their voice to show up with their bodies, to volunteer, to get educated, to be heard? What's working? Give us things to do.
Yeah, so I've been living in Europe and more specifically in Berlin, Germany since 2017. And during that time, I have had access to seeing what can happen when a society has universal health care available, but not just that, but free childcare, things such as higher unemployment benefits for people when they need it, as well as family centers and so forth. And I bring this up mostly to say that when a society uses the tax money that gets distributed for the benefit of people to be able to live better lives, and where healthcare, when you have surgery and it is free, that creates a dynamic and a situation whereby people might be able to breathe a bit more and to
Sure.
feel calm and rested and less oppressed, I would say. And that shouldn't just be happening in Europe. I think that can happen on a global scale. And then people can start to trust on a whole medicine and
Sure.
science a bit more.
Hmm.
And beyond that, I would say that we owe it to each other to provide some type of care, whether or not we can afford it. So I would say, on a very basic level, I hope that people can demand and make a case by writing to their MP or senator or congressperson. Sorry, I said MP.
No, that's all right.
And to their senator or congressperson to indicate why we should be advocating for Medicare for all. But beyond that, I would say on a local level, educate ourselves, read books about the health and the history of vaccines or the history of science. Demand that local libraries carry those books. Go to town hall meetings and city council meetings. This is something that's so wonderful within the US context, that there's a lot of local power and authority.
Hmm.
And perhaps there could be at the local level some way to say that we want to guarantee universal health for every resident of the city of
Hmm.
Dearborn, Michigan, for
Sure.
example.
Sure.
Beyond that, I would say that states often have a lot of rights and authority, and perhaps also maybe demanding some type of universal healthcare program at the level of the state, and really seeing politics not just within the context of a ballot, but also within the context of people being able to show that they have agency over their lives and coming together and organizing around issues not just concerning health, but also those regarding education. But beyond that, people can't protest if they can't go to city council meeting. Hopefully they can sign a petition.
Hmm.
Hopefully They can encourage a loved one to donate to a campaign that is trying to fight for the improvement of everyone's health and so forth. But at this point, I think that some form of collective action, learning from each other and learning to trust and have hope might be the best step towards then envisioning a future that is better than what we have right now.
I think that's amazing. On the one hand, like you said, if we want people to trust in these institutions again, if they're still around tomorrow, or since we got on the phone, if we want them to trust in medicine and medical providers, we have to give them a reason to do so. We have to look at one of my favorite groups, speaking of Haiti, is Partners in Health. And I'm a big fan of the late Paul Farmer's work. And I had the woman who runs Partners in Health now on the show last year. The ability to build community health clinics that really serve people, that establish this baseline of wellness. So like you said, people can start to trust, they can have agency, they can help each other, they can make plans for the future for their children. If we can start to do that, then hopefully we can reach a little higher for some of these things. But like you said, you know, I always tell people climate change is, the heat you feel on your back, it's the water you drink, it's the air you breathe. On the local and state level is really where you're going to see the most impact of any action you're going to take. And it's, who you're going to connect with. Somebody out down the street might have different political perspective than you, but they're breathing the same air, whether, whether they believe where it's coming from or what it might do or not. So I really do appreciate that. I think it can go a long way. I think that's really where people could feel like, oh shit, look what we did. We were able to do this. And that there's really no feeling like that, no matter what you're activating and organizing for. It really does go a long way. That's really helpful. Thank you. I appreciate that perspective. Are there any specific groups you're a really big fan of that are doing work in Europe or the US or wherever it might be that we can point people towards?
So I wouldn't necessarily be recommending specific groups,
Sure.
except to say that I also have praise for groups such as Partners in Health, which has worked in Haiti, Rwanda, and some other countries.
Mm-hmm.
Doctors Without Borders as
Mm-hmm.
well has done some excellent work and globally. But I would also say that it's important to be also helping to support media in this period and independent media.
Yeah.
So I love Democracy Now!, The
Yeah.
Intercept, and Jacobin Magazine within the US context. All of these publications are asking, very important questions and concerns regarding the state of democracy, but also the state of health. And in the UK, Novara Media and The Guardian are pretty good as well.
Mm-hmm.
So I point that out, the media question, because that is also a place that is currently going under attack. And we hopefully can continue to fund these programs so that they can exist. Oh yeah.
Right. No, I appreciate it. Again, it's stark. We have to paint it that way. And it really does go a long way. I mean, you are paying for the journalism that really sheds light on these things and helps make sure redlining doesn't happen, 4-H doesn't happen, like all these different things. So people understand, the baseline situation and how it works. One last question before I get you out of here. In all your time with an 8-month-old, what is a book that you've read recently that's not this one, this doesn't count, it can be anything. We like to say it's opened your mind to something you hadn't considered before, it changed your thinking. But honestly, like truly half of the guests are like, it's just like books I read with my kids and it makes me happy. So those are totally legit too. That's half of mine.
Oh, recently, I have been quite a voracious reader, which I normally am, but I had a little break before the book promotion.
Yeah.
However, I picked up the book The Anthropologist by Aysegul Savers, and
Okay.
it's such a wonderful book. It was published in 2024. And part of what I love about it is that it follows this unnamed protagonist and her experience in an unnamed city in Europe and what it's like to be a migrant, her and her partner, and the ways in which she's trying to find a home or make a home with her husband and the different people that she's forming community with. It resonated a lot with me, mostly because of her framing of trying to be a creative person and living that diasporic life was quite familiar, and even just like how to be in the world when you're moving in and out of multiple languages is something that I feel in Berlin. Even, and perhaps the reason she left the protagonist in the city unmade
Mm-hmm.
is because, yeah, she wanted those of us who feel out of place to kind
Sure.
of connect with that protagonist and the story. So yeah, The Anthropologist by Aysegul Saber.
Amazing. We'll put that. We got a whole little list on Bookshop, and listeners love it. So that's fantastic. I mean, again, I feel like I could dig into this all day. We didn't even really touch on cholera very much. There's so much going on in there. We'll definitely include some other resources. You mentioned it here, and like you said, some of the fiction and the writers and things like that for people to dive into. But I can't recommend it enough. The reviews are they're fantastic. It really is. It's something else, and it's really necessary to look at how we got to where we are and really why, and the choices we can start to make going forward, learning from the people that overcame and persevered through a lot of this, especially individuals like yourself. So I really appreciate it. I hope we got that in under nap time.
Yeah, we definitely did. Thank you.
I know that ticking clock feeling. That's it. You can read our critically acclaimed newsletter and get notified about new podcast conversations at importantnotimportant.com. Thanks so much for listening, and thanks for giving a shit.